Well, good morning, everyone. This is Joseph from Adjuvant Protocols for Healing. Welcome to you all today, whether you're on the East Coast or the West Coast of the United States. As you know, these particular Zoom webinars are based on my book that's almost 2 years out now, Adjuvant Protocols for Healing. And of course, you can get my book on Saline River Press. And as you know, I devote these webinars to the protocols in my book and go into why I chose the products and how they are best used and the implications of those products. All of my recordings you can revisit if you would like. There's almost 40 now over the last 2 years. And they are all on my YouTube channel, youtube.josephantell. So, or you can use this link, as today is being recorded as we speak. I think it's been over 2 years now. Lynn Mayer asked me to create a series on the endocrine system. And of course, I have great thanks for Lynn and Ellen in Connecticut, who's been my assistant since 2003. And Lynn, because I don't wash windows and I don't create PowerPoints. So without these two wonderful people, you would not be getting such wonderful notes and these PowerPoints. You'd be just hearing me speak without any visuals. So my great thanks to both of them. This series that Lynn suggested I create was for her particular group in Colorado Springs. So welcome to all of them that might be on today. And this is the last in the series of 7. I have gone through each endocrine gland, and this is particularly relevant today because it's the last one on the gonadal system of the body and related vitamins, minerals, and like proteins and their application. I tried to create this hour and a half with male and female, but that was just too much. So I created a 2-part series, as you can see. This today will be devoted to female, and next month will be devoted to men, to the male. I wanted to give that justice because oftentimes, predominantly, women are challenged in life with this area of their body, and men not so much until they get older. But so I wanted to give both due justice. And what I'm going to share with you today about female health is so crucial for all of you that are of the female gender and young or old. So as we know, the endocrine system is made up of 7 primary ductless glands. And I wanted to introduce another thought today that I've been meditating on and considering. I would like you to think, as I do, about the endocrine system and these 7 ductless glands. They are really small parts of the overall human body, the smallest being the pineal and the largest endocrine gland being the thyroid. But I want you to think about this as you continue your experience as a healer, as one who works and helps people, and for your own body and for your family's health as well. I want you to think of the endocrine system as the conscious part of the body. Other teachers may not agree with that, but this is what I have found to be true, that the endocrine system is really an alliance. Mark Anderson has really brought to us clearly about the immune alliance, about it being made up of many and connecting with many different parts of the body related to the immune system. And I think that is so valid. And I started thinking about what he said. And it is true of the endocrine system. The endocrine system is aware, here's how I would say it. This is esoteric, Joe. The endocrine system is aware of all things in the human body, what is going on with that person simultaneously right now. And it works in an alliance. Now, in recent years, they've found that other organs, and I've shown you this, the heart, other organs secrete, give out hormones of various kinds. But the 7 endocrine glands that we've come to know, these ductless glands, are the only ones that secrete very small amounts of hormone into the bloodstream directly. They govern and influence everything. So think of it as I say, the conscious part of the body. The other organs and systems are functioning in the rhythm of the life of the body, but they are directed by what is going on in the endocrine system. These hormones, and the reason I came to this was this original definition of a hormone, which means I arose and set in motion, and particularly related to the gonadal system. You'll see by the end of this hour and a half, how much is set in motion by the ovaries and the testes. But we'll consider, as I say, the testes later. Dr. Lee knew this. He was bound by this truth throughout his life to make this a priority. That's why, if you look at what is available in the protomorphogens, there is one for every ductless gland. And this article, which I've read to you, you've seen, you have this, that he gave a pretty clear explanation. He made a very clear explanation, but the person who wrote it misinterpreted or wrote it a certain way because of a lack of understanding. So, and he basically, Lee was saying here that that the working of the human body is a breaking down of animal and plant substances. And he described it in the article, the writer described it as 3 classes of vitamins, which is where he didn't have the full understanding. And the 3 classes that Lee said you must have in order to empower, enrich, restore is the accurate vitamin, the accurate mineral, and the accurate like protein, i.e. protomorphogen. For that, in this instance, we're looking at the gonads. So now this is the chart, as you know, that I've created for you. And we're going to look at this today with the gonads here. And the vitamin is the vitamin E, my recommendation related to the gonads. in both male and female is wheat germ oil. The mineral is zinc. And the protomorphogen is the orchic PMG in the male and the ovotrophin in the female. For the male, the herb would be tribulus, though they are interchangeable, by the way. And for the female, wild yam. And of course, the action step, because in our service to others as healers, the main foundation of what we do, no matter what modality we use, is to teach them how to live, or to reteach them how to live properly. And of course, related to the gonads, this last in the long line of these 7 endocrine glands is the need for intimacy. And you're going to see how this does apply to the female today and also the male next month. Closeness with each other, loving one another, and nurturing, taking care of ourselves, taking care of others. So, as I say, this is just a close-up of what I just read to you. And Dr. Lee really, in this one sentence, really made it clear, really spelled it out. He was a man who, as he taught, he said a lot in very few words. And that was one of his great gifts in lecturing, which he did all over the United States for many years, to medical doctors, dentists, naturopaths, homeopaths, chiropractors, osteopaths. School after school after school, he would come in and teach. He was well known throughout the country in his years on Earth, and started as a young man, actually. But this principle here is something that I've taught before, but I don't think you should get it tattooed on your arm, but something you should remember as anyone steps into your office and comes to you for help. Because the body is, from the time of birth, is aging. And we see this particularly now with about 25% of this country is the baby boomer generation. By 2025, 25% of this country will be retired. They'll be older people, a quarter of this country. Old age in general is probably the development of these antibodies, one after the other, to one specialized tissue after the other. The body ages because the immune system begins to attack it. Now, not every condition and every disease is considered an autoimmune condition or autoimmune disease, but all conditions are challenged with this at some point in the process of inflammation and then disease. And some say disease and then inflammation, which is okay too. But there are inflammatory occurrences in the body that it's not disease yet. But the inflammation is a big part of that. But at some point, the immune system begins to attack those necrotic tissues in the bloodstream. After it creates the antibodies for them, then it goes to the primary organ gland or tissue. So this is very important. Dr. McGarrison, who wrote, and you can get his lectures on the Saline River Press Historical Archives. There's quite a few of them in there. Was a great doctor and nutritionist in the early 1920s. And in Judith DeCava's article, Hormone Helpers, and Lynn's going to put that into the chat box now so that you can have this whole article. But Dr. McGarrison observed that the endocrine glands were among the first structures to atrophy or degenerate. If they didn't have the accurate vitamin, mineral, and like protein for them, they would degenerate first. Now, when we're looking at the female gonads, this is so very true. Remember, they degenerate because the immune system is now attacking that particular, the ovaries, the uterus, the breasts. So, and we know we must feed our gonads. General gonadal health, and this is, of course, from my book. If you're looking for just something general for young or old, these would be the products to use. Now I'm going to show you quite a few protocols today and get into them. So, but remember that the gonads, the ovaries, have to do with what is new coming and what is old leaving, what is coming together, what is falling away. Not just something that is ignored, because women in particular cannot ignore these cycles. They live with them. And I have said to men over the years, if you had to release blood from your body every 28 days, you wouldn't be able to take it. And our gratefulness, as far as how women, as men, we should be very grateful how they have learned how to honor their bodies, to cope with these cycles, and all the way through menopause when the cycling stops. So, and again, this relationship with the endocrine alliance, with the pituitary, and know and understand the primary hormones of the female, which is estrogen, which has been referred to as the hormone of femininity, of beauty, and progesterone, which is the hormone of not just conception, but and gestation, but every month, the cycling of that. And of course, this is very well written. And I'd like to read through a little bit of this. The hormones, the hormone estrogen stimulates the development of the female sex organs, the breasts, and other sexual characteristics. Estrogen contributes to the molding and shaping of the female body. It also initiates ovulation and the starting of that menstrual cycle. Estrogen also has effects on bone activity. Now, others teach other parts of nutrient benefits for the bones and joints. But do not forget that the bones have estrogen receptors, and this is what medical science is missing as far as osteoporosis and osteopenia, because the estrogen has to be there at some level in order to sustain and maintain proper bone integrity. However, synthetic estrogen therapy has been noted to create side effects such as fibroids, breast disease, fibroid cystic breasts, breast cancer, diminished sex drive, headaches, sleeping problems, water retention, and a tendency to put on weight. So this is something to remember, that medical science cannot duplicate what nature brings to us. They have never been able to do it, and they never will. I have had women tell me that they have never taken synthetic estrogen. They're not aware that non-organic beef and chicken contains traces of synthetic estrogen. This hormone is put in the animal's food supply to increase fat production and to increase profitability. Oh, yes, when they sell the meat. Okay. Unfortunately, these synthetic hormones can create allergies to the body's own estrogen. Now, this is one doctor's opinion, and I'm sorry, I don't remember who. I think this is Eric Berg, is a doctor in Virginia, I believe. But he writes really well, and this is his own opinion, but I agree with him. Hormones from the cow go right into the milk, cheese, yogurt. They also are transferred to the eggs from chickens. Make sure you consume as much organic protein as possible. Well said. Since estrogen has an effect in the deposition or increased quantities of fat in the tissues, an imbalance can cause increased weight gain in spite of dietary changes. Now, listen, we all have clients that they struggle so much with their weight. This is a well taken point to explore and consider. And in my opinion, eating too much of these meats. Now, I'm not a proponent of vegetarianism, but I think Western civilization eats way too much meat in amounts throughout the day and in amounts at each meal. The areas of the body most likely to accumulate fat are the buttocks, thighs, and stomach. In problems with the beginning of the menstrual cycle, estrogen is responsible. If you've heard me say many times, that's an estrogen issue. That's a predominant estrogen predominant issue. Many of my clients who have had PMS, cramps, hot flashes, and other cycle problems have been found to have allergies to estrogen. So this is how he's saying it. And I agree. The body is reacting to these chemicals that it doesn't recognize, can't use them. And so that there's a resistance, again, built up. This hormone, now he's talking about progesterone. And the important thing to remember about progesterone and estrogen is they must balance each other, just like a teeter-totter, a seesaw, however, whatever, if you remember that as a child. It has to be right in the middle so that one isn't predominant over the other. This hormone is the building block to estrogen, testosterone, and adrenal hormones. It helps to protect against fibrotic breast disease. It helps to use fat as energy, acts as a natural antidepressant, sense of well-being, and we're going to talk about that in relationship to chaste tree a little bit later. Acts as a diuretic and helps blood clotting, maintains sex drive, helps to normalize blood sugars. I didn't know that before I read this. And assist in the building bone and protect it against osteoporosis. So it isn't just the estrogen, as I just said. It's both of these working together. It also inhibits facial hair in women, as well as normalizes zinc and copper levels. Lastly, it supports the second half of ovulation, making the uterus ripe for fertilization. So that's how it assists with gestation and conception and gestation. The fibroids and endometriosis respond well to natural progesterone cream if the person is not allergic to progesterone. This hormone also has effect on breasts and can cause excessive swelling and an imbalanced state. This hormone will cause problems during the last part of the woman's menstrual cycle. Progesterone causes excessive fluids to be released from the body. Now, I am not one that encourages the use of these progesterone and estrogen creams or testosterone creams. Some people use them, and as a health professional, you're going to have to decide where you stand on that. If the right supplements and herbs are used, people don't usually need them. So, and I'm going to read something from Judith DeCava on this in just a minute. So these are, again, my notes from a lecture that I gave as well. And I'm not going to, many of them are what we just read. But I do wanted to say about estrogen and the inference also to progesterone related to bone mass, because that is something in this 25% of the country, you're going to start to see a lot more women and men having to deal with joint issues and bone problems. Do you know how many surgeries now, knee replacements, shoulder replacements, hip replacements, ankle replacements? It is out of control. That's the only answer they have. Drugs and surgery. And so as we have agreed when we became a holistic or a natural practitioner, healer, we all agreed that we would do as much as we can from our tool bag to assist these people. So these traumatic surgeries and drugs don't have to be used. Many people buy into it, and they have to live with those consequences. I won't say suffer, but there's always an outcome from using them. So remember that bones, I'm not talking about osteoporosis today or osteopenia, but I wanted to mention this just so you're aware of it, because it ties right in with estrogen and progesterone. Really, the woman's body peaks as far as bone mass development and growth at about 30 years old. Then there's a maintenance period. And then there is the dealing after 40, according to the source that I used here. After 40, then you have to deal with the decline. So remember that the adequate density throughout life doesn't just tie in. Remember, there is this great alliance with the endocrine system and the rest of the body. And here are the keys to, just briefly, to osteoporosis and osteopenia. Parathyroid health. Now, you can't have good parathyroid health without thyroid health. They are integral parts of the same endocrine. And Lee said that the parathyroid gland does give off hormone. Normal fat reserves, healthy hydration, and adequate protein intake, essential amino acids. We've discussed that, especially tyrosine. Now, I'm gonna read you a few things about the ovaries and how they are intimately connected with the adrenals, the thyroid, and the pituitary in particular. This has been known since forever. So we'll get to that in a second. So I'm not going to read through this, but I did want to make this one point about if progesterone is out of balance, then suspect that, as I said here, that there is a pituitary issue, because the pituitary gland oversees and plays a role in the ebb and flow between estrogen and progesterone. So let's start looking at some of these conditions that that people suffer with, women in particular, as we consider their endocrine function. So amenorrhea, as you know, is the absence of menstruation. And so this is a red flag if by the age of 15 that women are not cycling normally. So as they say here from Mayo, the secondary amenorrhea refers to the absence of 3 or 4 periods in a row by someone who has had periods in the past. So you have to remember, and this is a great article just explaining all of that. Remember that I said that all of the 7 endocrine glands work together. And this has been known since before the early 1900s, but doctors from around the world, before the influence of a lot of synthetic hormones, they were talking about using glandulars. And you could say, well, Joe, I know the pituitary, thyroid, adrenal, and ovaries are all linked together. But these gentlemen and gentlewomen were looking beyond that and finding other things. This is very interesting. And I did not remember this or know it. Among those who believe that the thymus definitely inhibits the sex glands, the thymus up to the age of puberty appears to keep the gonads in check. The thymus, everyone. That's not a misspelling. I'm not misspeaking it. It's not thyroid, it's thymus. An action of greater importance in the female than in the male. From personal observation, I am of the opinion that the 2 glands which dominate and control ovarian stoma are the anterior pituitary and the thymus. So here is a pearl. And, one of my great joys in teaching you and providing these lectures is to dig these out. These pearls, these ranges of wisdom that doctors were looking at that have been forgotten and just, no, I don't agree with that. And in all the challenges that people have, many of them, endometriosis is one. We'll look at that in a second. They don't know what causes it. Well, these gentlemen and women were finding things that worked. And as far as I'm concerned, and I know all of you, all I care about is what works. I don't care what science and all these studies. I don't care. The study is the living study of people getting well. That's the study. That's what I want to pass on in my lifetime. Having proved that it is possible to cause development of the reproductive organs by means of the anterior pituitary, we are confronted with the question of how to inhibit them. So again, what they're saying is, remember what I said about the pituitary plays a part with this balance of estrogen and progesterone. They were also saying that the thymus. Now, if thymus can control the ovaries in acne, it also to do so in dysmenorrhea, cramps, right? Menstrual cramps, heavy periods, excuse me, which is due to ovarian activity. I'm sorry, ovarian overactivity. So Oliver then reports, another doctor, this same doctor, reports a case that illustrates this theory and remarks, it will be seen that it is possible to use anterior pituitary to develop the gonads and thymus to restrain their activity. Very interesting. One other little pearl that's here that I won't get into, and this doesn't relate to our topic, but if you should have this book and read through it. It is truly amazing. And I've brought you every time I lecture, just about, I mentioned something of this book. Listen to this. A fluoroscopic examination should be made when there is asthma or any other suggestion of persistent thymus. This important possibility is often overlooked. All of the evidence goes, they didn't say some, goes to show that the thymus is an opponent of sexual development. And when it persists, its influence may interfere with the customary initiation of the ovarian cycle. So these are things to keep in your memory bank, to write them down. You're trying everything else that I possibly can give you and other teachers can give you. No results. Try some thymus. Thymus PMG would be it, not Thymex, by the way. And remember it in relationship to asthma too. There's so much what I could spend an hour just on this one slide, which I'm not going to, of course, but you can read this through. And so very crucial. And it is interesting. I just spent some time with Charlie Dubois, the president of Standard Process. They have this research center in North Carolina. Now, Charlie has spent millions on this research, and they are researching the protomorphogens. And it is interesting, he said, and they're evidently testing on white mice. And they were testing cardiotrophin. And for some reason, they decided to try some of the other protomorphogens, and they found that the thymus corrected some of these heart issues in these white mice more, yes, I said more than cardiotrophin. Now, I don't think he knows yet what that influence is. But I have said to you over the years, the thymus is the protector of the heart. Obviously, the thymus is also the protector of the lungs based on this one sentence. The thymus is also the protector or the balancer that works in conjunction with the pituitary for ovarian function. So let me leave you with that today to digest. So amenorrhea, which is the absence of the female monthly cycle, these would be the products that you would use. And I'm going to briefly touch upon these products as we go along here. Ovex P and Simplex F. Now, we know that Simplex F is pituitary, thyroid, adrenal, and ovarian protomorphogen on an empty stomach. Here it is. right in my book. But I'm also recommending and have recommended the OVEX as well, OVEX or OVEX-P, and I'll explain that in a second. In this case, both need to be used, and I'll show you why, as well as chaste tree. If those cycles are not being initiated, what did I just read? The progesterone is the hormone that initiates these ovulation and menstruation cycles. And without, if it's the body's not balancing that out, chaste tree is the herb that encourages that. And of course, the protomorphogen related to uterine function is eutrophin. So now menorrhagia is heavy menstrual bleeding. So here is just the opposite, right? The opposite condition of that. Now, we know that I wrote in some conditions that I have found in my experience of 50 years now, the causes for this heavy bleeding: endometriosis, polycystic ovarian disease, whether the doctor diagnoses it or not, whether the young woman or the woman knows they even have it. Or again, excessive estrogen, low progesterone. Well, let's see what this article says. If hormone disruptions cause irregular ovulation, the lining of the uterus can build up and become too thick. When this lining eventually sheds during menstruation, heavy bleeding can occur. This is common during puberty and pre-menopause. That's why they do a DNC on a woman with just before menopause if they have this heavy bleeding. I went through this with my mother when she was that young. And one of the reasons we got into standard process, because it helped her. It can sometimes occur due to weight loss or stress. Remember that. You get young women that come in and they're thin as rails, find out what they're eating or not eating, or as a symptom of certain medical conditions. And here it is, same as what I said. But what I want, the reason Lynn pulled this out, which is very interesting, young women, and it could be PCOS, hypothyroidism. Put that in your little Pearl toolbox. Hypothyroidism. Young women that live in states that are landlocked, not enough iodine. Here it is. Key for these excessive bleeding. So it's quite a bit, isn't it? How the endocrine system has to work together. And here is Mark, and thank you for Mark for sharing some of these PowerPoint slides. You can actually see Mark Anderson and my teacher, others teachers. I met John first in 1972, and he became a great teacher of mine. And a lot of what I share and know comes out of his wonderful knowledge. And of course, his teacher was Dr. Lee. Dr. Lee had passed away by then. Dr. Lee passed away in 67, and I came on in 72. So unfortunately, I missed him, meeting him, being with him. OVEX. So remember that OVEX is the bovine ovary cytosol extract. So that's different than a protomorphogen. It's a different part when they break down the organ in these great vats. So, and this is OVEX, anything with an EX on it relates to more function. I don't like to use it's a stimulant, because that's not entirely true. It would be a stimulant If the organ or gland was underactive, then you could use the word stimulant. But Ovex relates to function, again, of providing an influence if it's underactive or overactive. So, and providing an action. So John said this was developed primarily to stop heavy menstrual bleeding. So that's your menorrhagia that we were just considering. Some women bleed all the time or too much. Some of them have longer than 5-day periods. They need Ovex. It has been also helpful in some other female problems, but it is primarily for the women with too much menstrual activity rather than not enough. Now, I'm going to show you that Dr. Lee said you can use Ovex in both, not enough or too much. So, and that you notice that I used Ovex in amenorrhea, not enough, because that's what Dr. Lee said. Ovex is not a hormone product. Remember, standard process can't have any hormones in their glandulars. That would make them a drug, and they're not. It contains enzymes that help the body make progesterone. So here is, people have asked, well, what do you have in standard process that's similar to chaste tree? It's Ovex, as opposed to estrogen. And why? Why is progesterone significant? Because it helps balance out the excessive estrogen, which causes the heavy bleeding. In an estrogen deficiency, a woman's period might only last a day or two. We just considered that. Whereas in a progesterone deficiency, it will last too long. Young girls who do not establish a regular cycle for their periods find that this product helps bring it into a proper cycle. And I have to say, chaste tree has, along with Ovex, from an herbal perspective, almost always works. And we'll discuss that and my thoughts in a few minutes. So here is out of the products bulletin. As you know, it's one of my Bibles that I look to every day. And I wanted to show you this background that Lee talks about. Amenorrhea, dysmenorrhea, menorrhagia, menopause, all Lee said that this product is implicated as at least a usage to try it and see if it helps balance out. This does not take away from the overtrophin in the simplex F or straight overtrophin. It doesn't. It adds to it. It's another range of how you can use these products for effective and accurate function. And of course, again, out of this handbook, this wonderful handbook of Harrower, remember everyone, Lee had other doctors that taught him, Weston A. Price. Lee had other doctors and people that he learned from too. He developed products out of what a lot of them were carrying in their lines. And Harrower, of course, was much older than Lee. So you could say that a lot of what Harrower was doing, Lee continued that, providing those substances at that time in our history. The perfect functional balance of the vegetative nervous system, he says, is dependent upon a proper hormone balance. So here, this doctor is looking at a basically normal functioning person, and he's saying, though, that the nervous system, it's quite a bit in this line, that the nervous system is only normal when the hormone balance is there. And there is an interrelationship between both, as well as between all glands of internal secretion, he proceeds. The vegetative nervous system may be likened systemically to a finely poised balance beam. Here I mentioned the seesaw earlier, resting on a pivotal support suspended from thyroid to ovary in the female or testicle in the male, the plane of the pivotal point being heightened or lowered as hyperfunction or hypofunction of these reciprocal glands may occur. Well said. The body is about balance, and all of the glands must play their part. And this is why, as I said, Dr. Lee learned from Harrower, learned from these other endocrinologists throughout the world, not just this country. And this is why he made pituitrophin, thightrophin, dermatrophin, and overtrophin. You can look up in your catalog what year that was made. I didn't put that down. But this is the product that I give to young women with challenges, with tendencies, with their cycles, or older women. Now you could say, well, Joe, what happens if they don't have, if their ovaries have been removed? I can hear you guys asking me that question. Then you would use Paraplex, which is pituitary, thyroid, pancreas, and adrenal. There's no use giving a protomorphogen. It's just a waste. It's not going to work if the gland doesn't exist. So if they've had a hysterectomy and their ovaries have been removed, same with utrophin. If the uterus has been removed, it's not effective. It won't hurt anybody, but it's not going to play a part. And, to some degree, they're spending their money on something that's not a benefit. So those two products, Ovex and Simplex F, which includes overtrophin. But from an herbal standpoint, as I said, the chase tree is my go-to that I've had the most results with. My granddaughter started to get acne, and she would do anything. She goes, I just don't want to have to deal with this with school and friends and boy and girlfriends, all of it. And she had, her cycles were okay, but a lot of irritability. I put her on, and I think I only put her on twice a day. It's all cleared. Now, remember that chase tree, if you use it, you have to be patient for 3 months. These aren't miracle tablets. They work in accordance with nature, and that takes time. So here's some of the benefits. Painful conditions affecting the nervous system. Now, what did we just read from the old endocrinologists? That the gonadal system, the endocrine system, ties in with the nervous system. So, does chase tree actually help the nervous system through assisting progesterone and estrogen function? The answer is yes. Circulatory system, respiratory system, associated digestive system disorders. We'll talk about that further on here. Inflammatory health conditions, aids in hair growth, lowers menopause symptoms, clears up acne. And I have to tell you, in both young women and young men, at any age, if you give them chase tree, I like to use 2 twice a day, their acne will clear up. Takes a little time. It's 100%, everyone. Now, I don't say that about many products. This is never not. Now, they can't stay on all the sugar and all the crap food that they're eating. Of course not. You know, we have to teach them how to live, again, rightly, cleanly. But here it is. Because what this does is it lowers the androgen. The cause of acne in young men and women is too much androgen. It's too much male hormone. And this just, it doesn't lower it that much. It just normalizes it. May promote lactation. Treats and by the way, it not only promotes lactation if a woman has a child, and you can use small amounts of this if a woman is breastfeeding. Now you have to be careful with that, but it does. But also it prevents any type of spontaneous abortion in women as well. What do they give them? Medically, they give them progesterone shots. Well, there it is. There it is. Because chaste tree encourages progesterone normal function and creates that balance beam effect. Treats enlarged prostate. Lynn and I were just talking about this. We've got a couple clients that we're struggling with this. And I said, Lynn, I never knew this, or I forgot it. I'm sure Lee Carroll taught it to me, or Carrie Bone. I forgot. Reduces uterine fibroids, remedies amenorrhea. Remember, the absence of the cycle, improves female fertility, treatment for endometriosis and PMS. You should add this to your armamentarium, believe me. It is the greatest. It really works well. So I'm not going to read this all through. This is from the clinical reference guide related to the Medier products, which I think you can still get this through IFNH, I think. And Lynn can put that in the chat box if she knows where you can get that book. And by the way, a lot of these comments here were written by Lee Carroll. Now, he has since retired and got into private practice in Australia, but he was my teacher since 2000 and a very dear friend. So, and then of course, eutrophin. Remember that principle that I started with that Lee said, when women have any of these challenges, at what point has it become an autoimmune occurrence, an autoimmune situation where now the antibodies that cleaned up the necrotic uterine nuclear proteins in the blood are now attacking the uterus. And what does he say? History of abortion, threatened abortion, vaginitis, uterine cysts, fibroids, back pain. And by the way, that bearing down sensation, bladder issues, by the way. Yes, you can try eutrophin for it. Many of you have asked me about that. Excessive or scanty menses, either way, same as the Ovex. Sterility and menstruation cramps. And listen, over the years, I've tried everything. When I was in practice, before I had Medier, I didn't have the chaste tree. And I'm giving them Ovex and other products, calcium, and it was not working. I would add in eutrophin, and sure enough, it would bring it around. The other product that will be mentioned throughout my protocols is Femco. Now, this is a great write-up on this, by the way. You should keep these notes. This is a combination of Shazandra. So what does that do? Shazandra gets rid of excessive hormone in male or female. White peony lowers that high estrogen. Great product for people that have had cancer, white peony. I take it 3 times a week. And shatavari, that increases fertility, increases sexual desire. Shatavari means the woman with 100 husbands. So that will tell you there. And you can go through this as to what it does. And it goes through each herb. It's very well written. I think Lee Carroll wrote that up. Now, this is an article from that I wanted I touched upon earlier that I wanted to, and Lynn also will put this into the chat box for you to download and have. If you have any difficulty, just send me an email and we'll send you these. And with this, when you get the notes, when we put the notes on my YouTube channel, you have this recording and you'll have the notes. And we put in these PDFs so you'll have the whole article. And Judith says this clearly. Listen, everyone, you have to get this. We cannot keep bringing things into people's bodies that are destructive. Now, you could say, well, I don't agree with that, Joe. It's helpful. That's okay. I'm happy to have that conversation. But by and large, she says it here, hormones are not nutrients. Synthetic hormones, all these creams are not nutrients. The reason the person is in the state they are is because they are nutrient deficient somewhere. We just haven't found the right protocol or for them. And in my book, I devoted my book to giving you ranges of things that will help these people with their deficiencies. These are nutritional deficiency driven problems, challenges, conditions. Yet they are being used as supplements by a growing number of people, ostensibly to increase energy levels for anti-aging effects, to mask symptoms, make up for unhealthy lifestyle choices, build muscle, promote athletic prowess, and more. Hormones like melatonin, and she goes in this article, all of these, DHEA, human growth hormone, and others have been portrayed as quick-acting and safe remedies. They're not. They're not. But manipulation of hormones is not as simple as adding hamburger helper to one's own glandular meal. Well put. So very important. So let's get into dysmenorrhea now and look at the products that they really are the most helpful. Now, we talked about the Chase Tree already, and we talked about the Simplex F and the Femco briefly. But with menstrual cramps, you have to be sure that these young women in particular, but some women suffer with this their whole time until menopause, that they have adequate blood serum calcium. And it has to be ionizable calcium. Ionizable calcium, because unionizable calcium is not available to the tissues. It does not get diffused into the tissue, only ionizable. That's why this has been standard process, #1 selling product forever. And of course, the reason that I have F and black currant seed oil is because this is the means by which that calcium, if the ionization process hasn't fully worked and they're still not getting calcium calcium doesn't belong in the blood, everyone. It belongs in the tissues, in the bone, in all the tissues. And in this case, the uterus. This is your delivery system here. The F or black currant seed oil. I have just found with women in particular with this Blackcurrant seed oil works better. Now, again, others may, oh, I like the F tablets. Fine. But the blackcurrant seed oil, in my clinical experience, works better than the F tablets in this situation. And then I want to go into Cramplex. So we've talked about the others. So there's your calcium lactate, which I reviewed, Cramplex. The first time Lee Carroll ever spoke, he was a pretty shy man, brilliant, pretty shy. He really wasn't comfortable lecturing. I said, come on, Lee, fly out. I was the rep in Connecticut. You fly out here and you can, I'll just get a few doctors together and you can start teaching with a few. Just lecture to me. So he stayed in my home. He did his first national lecture in my home in Connecticut, in my basement, which is also was a classroom. There was a doctor there that was, she got up and whispered in my ear, I'm going to have to go. I have such bad cramps. I have to leave. And so I had some Cramplex upstairs. It was for my daughter who was in school in Connecticut at the time. She had left it there. And I brought it down. She chewed up 2. And I said, are you willing to just do a little experiment with me? I'm new to these herbs. Can you do a little experiment with me? And within 10 minutes, cramping had stopped. She stayed. She stayed the whole 3 hours, I believe it was. And then she became a great account. Changed her life just by using the Cramplex. Very simple. And again, you can read through this, what Lee Carroll says about it here. But the other thing that I discovered, another little clinical pearl for you, is these people that get chronic hiccups, Cramplex stops them within a few minutes. All they have to do is suck on it. Extreme vomiting. If you get someone that like in when they get food poisoning. Now, food poisoning, they're not, if you have them swallow a Cramplex tablet, they're going to throw it up. But you can have them suck on it. And it stops all of that smooth muscle cramping, and that it even calms down the nausea because there's ginger in there. It is a great product. It's a great product for food poisoning, which is not our subject today. But so this is, and any type of cramping, even I've used it in leg cramps that nothing else. We did calcium, magnesium, vitamin F, E2. We've tried everything. Cramplex stops that cramping. So, or anyone that tends to cramp, they can take it just before bed if they have night cramps. And you're doing the calcium and the F and the magnesium and the E2. It's a great product. I love this product. I am never without this product in my house. So, and so here another that we've discussed about, especially this this tremendous imbalance in between estrogen and progesterone, which we've discussed. But the key to endometriosis, and Lynn pulled this out, which I thought was great. And we gave you the article, but Lynn pulled this out today. It's great. The causes of endometriosis are still unknown. Well, thank you. That leaves me with absolutely everything about nothing. I don't know what to do then. But then they go into the theories, which is really, in my opinion, the real cause. One theory suggests that during menstruation, some of the tissue, these endometrial cells, backs up through the fallopian tubes into the abdomen. When they go in and do the laparoscopic surgery with these women and they freeze or burn them off, which is only a temporary fix, they find them all over. They're just in the abdomen. They find it not just on the uterus, but all over, attached to the intestine. A sort of reverse menstruation, they call it, where it attaches and grows. Another theory suggests that endometrial tissue may travel and implant via blood or lymphatic channels, similar to the way cancer cells spread. Wow. There it is, everyone. Because most organs in the body are receptive to these endometrial cells. And so you can get them anywhere, but mainly it's, of course, in the ones that we know, the uterus and down into the intestine. A third theory suggests that cells in any location may transform into endometrial cells. That is correct. And that is the reason you're probably saying, why the hell did Joe put spleen PMG? This is a famous story that Mark told me, and I tried to, this woman retired, but in Utah, she surmised that the only organ, remember what they're saying here, any organ, gland, any organ can transform into endometrial cells. They all have that capability, except one, the spleen. The only organ that the endometrial cells have never been found in is the spleen. So this brilliant practitioner just surmised, well, then if I give them the spleen protomorphogen, now you could, some of you are asking me, well, what about the desiccated spleen? I don't know. I don't know. I've never used it because that's not a Dr. Lee product. So I don't know. What I have found to be true is this, and this woman was strict. She said, I have tried all the other dosing. Doesn't work. Only 12 a day. Now you could say, well, geez, Joe, I got clients. I don't know, 12 a day, it's a lot. Well, the alternative is surgery or tremendous suffering with endometriosis. And so I have had two clients. One of them, after helping her, came and worked for me for 2 years when I was a rep in Long Island and Connecticut. She just fell in love with the products. And the story about her, which is such a wonderful story, she could not conceive. She could not have a child. And so they were about to adopt, but they were, of course, adoption takes forever, and it just wasn't going through. So I said, well, why don't you try this? And after about 3 months, because Chase Tree also helped, Utrophin also helped, this protocol, I based this protocol on her experience. 3 months, she conceived. Not only did she continued doing this, these high dosages, it was hard. Now, once she conceived, she didn't take the Chase Tree or the Livco, but she took Utrophin and I think Simplex F and the spleen. Once she, and not only did she conceive one child, 2 children. Yes, great story. And then I had one other woman that was a client of mine, and same thing. Same thing. Now, this other woman didn't want to continue it. It got so bad, she had a hysterectomy. So, these are the people, the choices that people make. And I understand it's suffering. So, you can only take so much pain. PMS is another. Now, the premenstrual syndrome is really, again, a product of this lack of balance between estrogen and progesterone. And so here is the simplex F, that beautiful self-regulating of the endocrine alliance. The chase tree, which is crucial, again, in that balance beam, as Harrower wrote in his book that we read. And of course, the other thing that I have found, and I believe Lynn helped me with this, she loves this product. She uses it all the time with her clients for many things. But one of the things about PMS that she found, and I honored her putting it in the book, which I agree with, is blood sugar issues. And here's a beautiful blood sugaring balanced product, as well as a digestive product, as well as it having pancreas and pituitary cytosol extract and protomorphogen, actually, too. Great combination. And then, of course, females that just cannot fully relax. It's such a challenging time for them. And so there is your Min-Chex, which is a common, or straight Or-Chex, but you've got to get either Min-Chex or Or-Chex into them. And so here it is. Now, Min-Chex is less potent than Or-Chex, but works just as well. I put that in there because a lot of clients will not take too many products. So this is a combination of calcium, organically bound minerals, Or-Chex, and B6 niacinamide and niacinamide B6, both in there. So there you have it. And what does Lee say here? Hyperirritability, depression, hypertension, capillary engorgement. Part of PMS has to do with capillary engorgement. Now, I don't have time to go into that today, but that's that thickening of the lining. Or-Chex is anything that is out of balance, whether it's the synovial fluid in a joint, whether it's too many neurotransmitters in the nerve synapses, whether it's the thickening of the uterine lining. Or-Chex is key. So underused product. Loss of appetite, skin lesions, adrenal insufficiency, menopause symptoms, nervousness, insecurity, mental aberrations, and just this overall lack of well-being. Well, if that doesn't describe B6, I don't know what does. I mean, if that doesn't describe PMS, I don't know what does. And then, of course, the polycystic ovarian syndrome. Now, I don't know if it's been determined that this is, in fact, an autoimmune condition, but in my book, it is. The immune system now is, these are cystic ovaries. The immune system is now attacking that, trying to get rid of it. So here it is. You must use the protomorphogen. The organ is aging. It's breaking down. I don't care how young the woman is. That's the sign. PCOS is a beginning of the wearing out and aging of that organ. Iodine is key for any cystic, and turmeric, by the way. Did I put turmeric in here? I guess I didn't. Probably should have. Oh, yeah. And then, of course, your Femco, because one of the other huge reasons is they need the Schizandra that's in the Femco. And then, of course, adrenal complex. And we'll get into the adrenals helping the female organs in a second here. Of course, chase tree. I couldn't put them all in the priority, but these are the ones that I've used most. Now, it says here, Joseph's, a PCOS blend. So here it is from my book. And it's a combination of white peony, settles down that high estrogen, licorice, which is again adrenal, and stops the replication of abnormal cells. That was implicated with COVID, that they did a study in Germany. It was published in their medical literature and no one ever did anything about it. Licorice stops the replication of these viruses because they're proteins, and there's your Shazandra, all in the liquid form. So if you didn't want to use the Femco, you could use this liquid blend. And believe me, this protocol I've had a lot of success with. And really anything in my book, I didn't put it in the book unless I had success with it. So one of the big things that we're working with here with all of this is the Western society. You don't see these situations in countries that are, stay with their traditions of food and less chemicals and influences. And this is really, really the key to this. These hormone mimicking compounds, xenoestrogens, plastics. But, if we drink water now, they're all in plastic bottles, most of us, right? Dyes, hormones in meat, and electromagnetic. Now, there's a lot of controversy. Some say, forget it, Joe. I tend to disagree with that. I say that this is a big influence, because people aren't getting better, they're getting sicker as we add these things into our lifestyle and our environment. So, and then, so, and the other thing is the toxic load that a lot of these compounds bring, not only hormone mimicking, but other compounds too. And this is a great article. Death Begins in the Colon. It was written in the early 1900s in the Royal Society of Medicine of Great Britain. Now, Lynn's going to put, again, a link to this whole article, but I wanted to read you this. They found, and I think this was 36 or 40 doctors, maybe it was 57 doctors, I forgot. They did all these studies in England, and they found that most of these disturbances that they mentioned for the eyes to the heart had to do with a toxic bowel. And that's why it's entitled Death Begins in the Colon. Here's the comment about reproductive organs. Various displacements, distortion, and disease of the uterus, change in the whole forms, contour of woman, fibrous of breast, wasting of breasts, induration of breasts, subacute and chronic mastitis, cancer of the breast. This all relates to the colon. Endometriosis, infection of bladder, especially in women, frequent urination, albuminuria, acute nephritis, kidney, movable kidney, floating kidney. Dr. Lane goes so far to say that auto-intoxication plays so large a part in the development of disease of the female gyno-uterine apparatus, that they may be regarded by the gynecologist as a product of intestinal stasis, the condition of the intestine. Now, over the years, and I'm sure a lot of you have seen this, where you get these young females with all of these problems, PCOS, PMS, endometriosis, all of these problems, challenges in their life. And you put them on a detox, And you know what? Their periods get better for a couple months and they go right back into it. So these products, the psyllium seed product, the whole food fiber products, any products that are going to sweep that bowel, ochrapepsin E3 with the small intestine, lactic acid yeast for the large intestine. All of these products, if they're taken as an assist, will help these conditions. And these doctors proved it. Now, talk to your doctor today. You go into your gynecologist, say, would you think my bowel's involved? They'll say, no. But they proved it. And you have the whole article. So the pill also upsets. The pill induces a biochemical state in the body more like pregnancy than normal fertility. It does this by stopping ovulation and making cervical mucus interpenetral in the lining of the uterus. So the pill is just manipulating the body. This is a great book, by the way. You should have this in your personal library and maybe get a half dozen because you're going to be giving them out to your clients. So let's, we don't have much time to go through all of these, but let's look at this with these meats. And let's see. In the US, there are 6 different kinds of hormones approved by the Food and Drug Administration for use in food production. These include the naturally occurring female sex hormones, estradiol, progesterone, natural male sex hormone, testosterone. There it is. And what about sugar, which we know a lot? These affect the mean ratio of estrogen to progesterone. So that balance beam is upset by too much sugar. Also irritability, anxiety, insomnia, menopausal symptoms. There you go. What about makeup, which was mentioned? The beauty products you use can be harmful for your reproductive system. A new study shows how cosmetics used in personal care products can cause changes in reproductive hormones. So if you're looking to clear hormones out without doing a huge detox, very simple. Livco from MediHerb is one that I recommend. That's why it's the #1 product. This is not a phase 1 detox product. It's a phase 2. It's a clearance group of herbs. Antranex, of course, dilates the portal vein and helps the liver express out into the bowel toxins. So does beta food and choline as well. So here's the information on that. And then, of course, these ovarian cycles, can begin to change anywhere between 45 and 55 years. And the true definition of menopause is you don't cycle for 12 months. So the adrenal glands begin to take over significant amounts of estrogen through making estradiol, estradiol, and estrone. So there it is. And of course, a lot of these doctors write about this. More specifically, the adrenals, like the ovaries, are also able to secrete progesterone, as well as other hormones, i.e. estrogen, and a precursor hormone, estrogen and testosterone. Until menopause, the adrenals' role to produce female sex hormones is minimal. So, so the adrenals take over. They don't overimpose when menopause is not there. Here's another. As our ovaries begin to decrease in function and stop producing progesterone and estrogen, the adrenal glands respond. They take up. And I I think it's up to 30%, but I could not find that article, so I didn't put it in. And here is the other thing about, I had mentioned Orchex or Minchex earlier, or the straight product, vitamin B6. Vitamin B6 in menopause is huge. Now, B6 is in Immuplex. You can look through the different formulas. It's in Catalin. So if you're giving a multivitamin, you're probably getting enough. But B6 is the adrenal vitamin. Just remember that. And here he says it here. This is a little pearl that I found that I just so love. Is found in adrenal tissue. B6 is found in adrenal tissue. And we may assume adds support to the function of these glands. This may be of particular importance to the menopausal patient, judging from the clinical benefits noted when used in this state. Some investigators claim that the adrenals, at least to some degree, take over functions of the ovaries at this period. And for this reason, the adrenals have been referred to as the ovaries of the aged. I love that. Love it. That one phrase, the ovaries of the aged, says, how much does it say? I know what it says to me. So here's my menopausal protocol, and basically Simplex F, you can use straight Overtrophin for a while. You need to use both, or Wild Yam, Minchex, and Adrenal Complex. Now, I didn't put B6 in there, but certainly you could add that, but usually you get that in your multivitamin. And as you can see, I did include that because it's in Immuplex. Oh, here is B6 niacinamide, yeah. So I did remember that. I didn't, there's so many things I don't remember until I teach you also. And of course, this relationship, again, Lee says it so beautifully here about the hot flashes. At the time of menopause, there is usually a loss of ovarian hormone, which inhibits the sympathetic nervous system. So what governs the sympathetic nervous system and the sympathetic? The sympathetic and the parasympathetic, is the pituitary. Here is this alliance between, that's why Simplex F is a product that I just put almost every female under or recommend it. Without this inhibitor, rise is given to the sympathetic atonia, with the splenic blood going toward the periphery. Instead of staying within the cavity, the blood moves out to the surface, i.e. the hot flash, accompanied by disturbances in calcium metabolism. So there it is. So, and what brings on a hot flash? A glass of wine, a cup of coffee, someone gets upset, eating a lot of sugar, all of that. So, and then there is the hot flash protocol, which the thyroid, again, a part of that endocrine alliance, the pituitary, thyroid, adrenal, and gonads, ovaries, is going to be your key to helping these conditions diminish. And of course, you could use thyroid complex too. I don't know if I put that in here. Maybe I didn't. But you get plenty of thyroid support in the Simplex F, by the way. Should be adequate if you're taking enough a day. How many do I recommend there, the Simplex? Yeah, 6 a day. You could even go up higher. So you can go through the rest of these because we're out of time, and go through. We've looked at most of these products related to this, and of course the lifestyle action that needs to be taken. And with vaginitis, you've got to use the vaginal douche. That it just because it works so well, and change the diet. And remember the gut dysbiosis. One of the reasons that the ovaries get inflamed, the vaginal tract, the uterus, the bladder, all relates back to that death begins in the colon. So remember. So even if you do this twice a month, it doesn't have to be done all the time. And of course, vaginal dryness. Now, again, you'd say, Joe, why did you put that Orchex in? Because doctors have told me over the years, this is the key product for vaginal dryness. So, and I've tried it and used it as well as the wheat germ oil. So, and Dr. Lee, I believe it was him that talked about breaking the pearls open and inserting the wheat germ right up into the vaginal tract. Now, I have found with my clients, female clients, this allocadabra.com is the best for if they're going to share an intercourse so that they don't suffer with that pain and discomfort. It is really the best lubricant. I've tried many of them and got feedback about many of them, and that's the best. So, and then again, we already talked about that as well, the Orchex once again. So, and remember that the really the key that the endocrinologists, the original endocrinologists were saying that if you don't have healthy ovaries, then the corresponding organs begin to fail. Now, as the ovaries decline, you'll see that. And here's how they said it. The writer also expresses the opinion that has been hinted at elsewhere, namely that the uterus and the prostate are analogous organs. So this is in your male and female. And that early cessation of sexual activity is liable to cause enlargement of the prostate. It is interesting to note that Gualpa, which is female activity, considers uterine fibroids to be the most common, the lack of activity, common in, this is the doctor's name, I'm sorry, in nulliparity, that is sexual activity. And since we are to consider the prostate as a male uterus, its disease should appear more often in inactive glands. In other words, keeping that intimacy going throughout life. And, you know, if you study the blue zone, all of these people that live to 100 and past are sexually active. They say it right in there. Now, it's not as much as a young person, but this is what they were saying. And this is real truth here. So, and the fact that prostatic hypertrophy quite commonly follows the functional retirement of the testes. So think of this in the woman as the ovaries abate, then they lose function, uterine function. And it's the same with the prostate in the man, which I'll talk about next month, has caused many observers to believe that there is a relationship between the endocrine activities of both these glands. It is believed that when the testes become functionally inactive, the prostate becomes enlarged in a compensatory fashion, just as other ductless glands enlarge when closely related glands are put out of commission. Do you see what the brilliance of what they're saying here? If any of the other endocrine glands diminish, problems occur in others. It's a whole network. It's a whole community, and they must be supported equally together. Now, we're drawing out the ovaries and the uterus and the testes and the prostate. The body is one. It's all connected. I connected in the bowel with a lot of these problems too. The bacteria leaching into the bladder, into the uterus, and these membranes cross over and create problems. It's all one body. It has to be taken care of as a whole. And cleanliness is key to that. And of course, then I gave you right in the beginning the key products for not only just general feed your gonads, that was my just general health, but that also same products tie in with the libido in the female. Same as low estrogen. So I just put these in and explanation of the products. So that ends our time together. And I'm sorry I went even a little longer than an hour and a half. I didn't realize this was so much information to teach you, but it's been wonderful to be with you all today. And I look forward to being with you next Tuesday on the Heart Sound recording lecture. And then next month, on the third Thursday of the month, to consider the gonad health in the male, which I touched upon at the end today. And I trust this has been helpful to you. It's given you some key principles. And I thank you all very much. And I share my blessing with you as we move forward here in our work together as healers. Blessings to you all.
Thank you so much, Joseph.
Thank you so much, Joseph.
You're welcome. Nice to be with you all.
Thank you.
Thank you. Bye-bye. Thank you.